Hello, welcome back to WonderFest TV. This is Arlene.
And this is Kat.
And we have got a superwoman here, a Wonder Woman here, Dr. Alene Falomo, naturopathic doctor. Welcome. Thank you for being here.
Thank you for having me.
So lovely.
I know, I'm really excited to chat with you.
Yeah, we want to talk about some stuff. We want to talk about health and mind. Now, naturopathic doctors, for people who don't know, can you give a really quick, concise difference or what the primary care of naturopathic is?
Sure. So naturopathic doctors, we're doctors that practice functional medicine. We use a variety of different modalities, including botanical medicine, acupuncture, homeopathic medicines, and clinical nutrition.
Okay, cool.
And we are a regulated profession. The Naturopathy Act of 2007 just got proclaimed in July of 2015. And so now we're regulated by the same legislation that governs medical doctors, nurses, chiropractors, and other healthcare providers.
Wow, so that's
amazing.
a recent thing.
Congratulations.
Yeah,
Thank you.
That's great. So I want to talk, because it's very nature-based almost, what your take on the nature versus science is.
Well, there is a lot of science behind naturopathic medicine and what we do. We put more of a natural slant on things, so we'll use herbal medicines to affect the system.
Right.
Or we'll use specific nutritional supplements that might be deficient in a particular patient to help them achieve their health and wellness goals.
Okay, and what to you is the connection between mind and body and health?
Mind and body connection is very important. And so we live in a society where stress is an issue, and a lot of individuals do feel stressed. The mind is extremely powerful, and so helping to keep a balance on stress levels helps with that mind-body connection. The mind's very powerful and allows the body to engage healing properties in order to heal itself.
Amazing. So what we like to ask is, how is your practice empowering yourself in your life and those around you?
I really enjoy what I do. I've been a naturopathic doctor for almost 15 years, and I practice here in Mississauga. The best part about my job is that I get to see new patients, new people every day with new health challenges. And what's empowering for me is being able to help an individual with their chief concerns, something that they may have struggled with for a while, and nothing's more rewarding than having a patient say, "Thank you, I feel so much better."
Awesome.
That's so great. You mentioned stress. How does that affect the body, and how often do you see that as the contributing factor to someone's malaise?
Stress is a large factor, and so stress is a normal body response. We work, we have home lives, we balance children, and so getting a handle on the stress is important, but it is a root cause of a lot of illness. There's many studies that support stress as a causative factor for cardiovascular illness, digestion issues, poor wound healing, poor surgical outcomes, or delayed healing. So stress is or can be a contributing factor, and I do see it quite often in practice. Helping patients to relax from the stress is key.
Is there something that our audience members can do maybe every day to kind of relieve the stress?
Sure. Well, there's a couple of different types of individuals. So some individuals need more of a rest, relaxing, repairing type of stress relief. Mm-hmm. So yoga or meditation is ideal for those patients. Other patients or other individuals need more vigorous. And so aerobic activity, exercise, rollerblading, dancing, Zumba classes is more of their stress relief.
So what is the difference between those two people? Like, is that a mindset, or is that like a physical?
Just their individuality. So
okay.
Some patients...
It's like a personality type
Correct.
thing? Oh, okay. Interesting.
That's awesome. What kind of person are you?
I'm trying to think. I do like to dance and mess around a lot.
I like both. I like to sleep a lot, but I do like to run. But I guess it just depends on the person at the time too, as well, right?
Correct. And so what one individual might need the vigorous activity to relieve stress, but depending on what the stressors are, that same individual might also need the yoga.
Yeah.
Right. Yeah, because sometimes I just want to sit there in a very quiet nothingness space, you know, just to kind of like decompress.
Is there something that most patients come to see you for?
Patients will come to a naturopathic doctor for a variety of reasons. I see a lot of digestive issues. I see a lot of pediatrics, skin issues, menopausal hot flushes, fertility, balancing for fertility. So there is a wider range of chief concerns that patients will come see me. Some patients also want to come for just general health and wellness and to try and optimize their health. They might not have a specific chief concern.
Well, and that's an important thing too, right? Is preventative medicine.
Correct.
As opposed to let's just wait till we're down and out and just try to treat the symptoms, right?
Correct.
Oh.
Yeah.
So if you could do one tip for everybody for a positive, healthy lifestyle, what would it be?
Positive, healthy lifestyle is look at what you're eating.
Okay.
Look at your diet and be a little critical of your diet.
Okay.
Right. Yeah, it's hard for me. I love food.
I know, I love all the nasties. But that's a really good point, and I think that starting now when we go for lunch, we should really look at that.
Yeah, definitely.
Thank you so much for those tips and
Thank you.
the insight into that. That's awesome. It's so great to see you.
Yeah.
Thank you again.
So
Thank you.
radiant. Thank you for being here, everyone. Do not go where the path may lead. Go instead where there is no path and leave a trail. Ralph Waldo Emerson.